Good morning, everyone. Welcome to Economic Alliance Snohomish County's Coffee Chats. Thank you for joining us today and for taking time out of your morning to engage in this important conversation. I'm your host, Rachel Morera, Director of Community Engagement for Economic Alliance Snohomish County. Coffee Chats is EASC's monthly virtual series designed to bring together employers, workforce partners, educators, and community leaders for timely discussions on issues shaping our regional economy. These conversations are meant to be practical, informative, and rooted in real-world challenges and opportunities facing Snohomish County businesses and workers. Today's session, Healthcare in Flux, What Employers and Workers Need to Know, comes at a moment of continued uncertainty. Healthcare coverage remains a critical factor in workforce participation, recruitment, and retention, and overall business competitiveness. With open enrollment behind us and healthcare policy, costs, and access continuing to evolve, both employers and workers are navigating new realities with limited clarity about what comes next. We're grateful to Herald Media for presenting today's Coffee Chat session and helping make these conversations accessible to our broader business community. I'd also like to note that today's discussion is in part informed by recent feedback from employers across Snohomish County. At the start of 2026, EASC launched a healthcare survey to better understand how rising costs, coverage options, and uncertainty are impacting businesses and the workforce. You'll hear several questions today that are directly shaped by what employers have shared with us so far, helping ensure this conversation reflects real local experiences and concerns. We've assembled a panel that represents both employer-sponsored benefit expertise and the public health insurance marketplace, allowing us to explore how healthcare coverage decisions intersect with workforce stability and long-term economic health. Before we begin the panel discussion, we'll hear a brief overview from the Washington Health Benefit Exchange to help ground today's conversation in current coverage trends and key considerations. Please join me in welcoming our panelists. Jane Hogland is President and Benefit Consultant at Health Benefits Washington Corp, where she works closely with employers to design and manage benefit strategies that balance cost, coverage, and workforce needs. Saray Childs is President of Business Health Trust, a member-owned health benefits organization serving employers across Washington state, with a focus on long-term affordability and innovative benefit solutions. And Genevieve Arredondo is Associate Director of Outreach for the Washington Health Benefit Exchange, where she leads efforts to connect employers and workers with information about coverage options available through Washington's public health insurance marketplace. Thank you all for being here today.
Thank you.
Before we move on to the panel discussion, we want to take a few minutes to help ground today's conversation in the broader healthcare coverage landscape. We're pleased to begin with a brief overview from the Washington Health Benefit Exchange, which plays a critical role in expanding access to healthcare coverage for individuals, families, and small employers across Washington state, particularly for workers navigating job changes, income shifts, or gaps in employer-sponsored coverage. This overview will highlight current coverage trends, enrollment considerations, and key takeaways that are especially relevant for employers and workers here in Snohomish County. So Genevieve, I'll turn it over to you.
So good morning, everyone. As Rachel mentioned, I am Genevieve or Jenny Arredondo. I'm the Associate Director of Outreach at the Exchange, and I am here to talk to you a little bit about Washington Health Plan Finder and the options that are offered on Washington Health Plan Finder. And then we will go into those questions and answers. Okay, so just a little bit of information about Washington Health Plan Finder and the Washington Health Benefit Exchange. So the Washington Health Benefit Exchange was created by the legislature about 13 years ago, and it operates our state's online health insurance marketplace called Washington Health Plan Finder. It is where 2 million, about 1 in every 4 Washingtonians, get access to their high-quality health and dental insurance. So on WA Health Plan Finder, you can search for and enroll in a plan that meets your needs. We literally do not care what plan you choose, just as long as it meets your and your family's individual needs. It's the only place where you can get access to federal tax credits, as well as our state premium assistance program, Cascade Care Savings. And it's where you sign up for Washington Apple Health, which is Medicaid in Washington state. So we are kind of the catch-all for the folks that are not offered employer coverage. So we're used by self-employed folks, employees of small businesses who are not offered health insurance, those that are losing employer coverage, those that participate in the gig economy, folks that work seasonally, and those that are not quite eligible for Medicare but do not have employer coverage. So next slide, please. So the number one question we get asked, which is very valid, especially these days, right, is how much does insurance on Washington Health Plan Finder cost? And it really depends, right? So Washington Apple Health, for those that qualify, is free or low cost. Around 1.5 million people use or qualify for Washington Apple Health. And then we also have what we call qualified health plans or qualified dental plans. Those are simply plans that you purchase, and the cost of those plans vary primarily depending on factors such as your age, your household income, and the county that you live in. Close to 300,000 people throughout the state are enrolled in these plans. These are really high quality plans that are vetted to make sure that they offer a lot of things before the deductible. And then those federal tax credits and Cascade Care Savings, which is our state premium assistance program, are available exclusively on Washington Health Plan Finder. Next slide, please. So the benefits of Washington Health Plan Finder, we get asked this a lot, like, why should we use Washington Health Plan Finder? There are other plans out there, and it's protected by the Affordable Care Act. So there's no denials for pre-existing conditions. You cannot be denied for a pre-existing condition. All plans have to cover the 10 essential health benefits, including free or low-cost preventative care and screenings and vaccines. It does give you access to federal and state savings that you couldn't get other places to lower your monthly costs and lower your overall costs. And then it allows you to easily compare plans based on price, benefits, and networks. Next slide, please. So this is what our website looks like. There are lookalike pages. So make sure that when you land or you put in Washington Health Plan Finder that you do land on a page that looks like this. We try to stay on top of it and get pages pulled down, but they do crop up. So make sure that you land on a page like this. And our website address is wahealthplanfinder.org, and that is where you sign up. It's meant to be a self-service stop or website, and so you can apply directly on the website, and the steps are listed on the homepage. Next slide, please. So when do you sign up? So Washington Apple Health, for those that qualify, is available for enrollment year-round. The qualified health plans and qualified dental plans, which are those plans that you purchase, are typically available during open enrollment, which starts November 1st and typically goes through January 15th. Outside of open enrollment, which is now, right, if you're experiencing a qualifying life event, such as you're losing employer coverage, or you're eligible for Cascade Care Savings, which is that state subsidy, or even if you're a small business owner, you may be eligible for enrollment outside of open enrollment. If you experience, a death in the family or a birth of a child, that does open a special enrollment period for you and allows you to enroll outside of open enrollment. So open enrollment just ended, but you may be eligible to still enroll. If you do lose employer coverage, you typically have 60 days from the time that you're losing employer coverage, so 60 days before and 60 days after, to enroll in a new plan on Washington Health Plan Finder. And we have lots of different carriers, lots of different plans available and here's some of the carriers that we work directly with to provide plans on Washington Health Plan Finder. Next slide, please. If you are feeling confused by health insurance, you're not alone. Health insurance can feel, confusing and overwhelming. The good news is there's lots and lots of support, and we actually have some support here with us. So there's lots of folks that can help you out. We do have a customer support center that you can call that has language assistance in over 200 languages. We also have what are called navigators, close to 1,000 navigators throughout the states We have tribal assisters focused primarily on supporting tribal communities. And we have close to 3,000 certified producers or brokers throughout the state that can recommend plans for you. If you're like, I don't even know where to begin, these are my circumstances, this is, what I need, they can recommend a plan for you that they feel like makes sense. And then, you confirm whether it does or not on your end. And then we do have 9 brick and mortar enrollment centers. If you go to our website, wahealthplanfinder.org, in the center of the page, there's going to be a button that says Find Support. If you click on that button and you enter your zip code, it will show you a list of brokers and navigators in your area that can really help you out. And you can even search, based on language that you need. Yeah, lots and lots of support out there to help you kind of figure out what the best option is for you. Next slide, please. So you all may have heard in the news that there are some changes happening to health insurance, right? We had a new marketplace rule in June. We had HR1, which you may have heard as the big beautiful bill, and then enhanced premium tax credits did expire. So the premium tax credits were enhanced largely as a result of the pandemic. Those kind of enhanced subsidies or enhanced savings did expire at the end of December. There are still premium tax credits available. They're just not as generous as they have been in the past. So we are seeing that, fewer people are eligible for the savings, I guess, that they were before, but savings are still available. It's just a little bit harder, making it a little bit harder for folks to kind of afford health insurance in a way that they have in the past. But we're going to talk about it. Don't count yourself out. There are still savings available. There are lots of different plans available here in Washington. And it's definitely important for you to check out your options and, see what makes sense for you. For about half of our customers this open enrollment, their plans did not go up. And in some cases, they even went down by a few dollars. So definitely be informed, check out your options and see what's available to you. But for some, especially those kind of middle to high earners, we are seeing higher premiums than before. But it is important to see, what your individual circumstances is. Don't count yourself out. Next slide, please. This is just kind of a breakdown. We are expecting kind of some more changes based on, federal regulations. This is a lot of weedy information. You don't need to get into the nitty gritty of it all. We are tracking and updating our system and informing customers, letting folks know, what is changing ahead of time so that they can, adjust, what makes sense to them. And so don't worry, we're on it, trying to simplify things for you and make sure that, you do know what is happening. And we're really trying to mitigate any harm that we're seeing to Washingtonians, to try to make sure that they still have access to affordable coverage here in the state. Next slide, please. And then here is my and my colleagues' information. If you need help, if you're a small business owner, we have my colleague Marie Cooper. Her job is focused on supporting small business owners. So if you just want to understand your options, or be connected to, a broker, she can do that. And then again, I'm the Associate Director of Outreach. If you have concerns, I'm happy to hear them. I love hearing, what's top of mind for folks and how we can help kind of mitigate some of those impacts that we're seeing and what your needs are, so that we can help communicate them back to the legislature. This QR code on the right-hand side leads you directly to our website. So just wanted to add that there. I think, and with that, I am all done with the presentation portion, Rachel.
Thank you, Genevieve. With that context in mind, we'll transition into our panel discussion and explore how these healthcare coverage realities are showing up for employers and workers on the ground, particularly when it comes to cost pressures, workforce stability, and long-term planning. For those joining us via Zoom, please submit any questions you have in the chat, and we will address as many as time allows. I see we did have a question come into the chat already during your presentation, Genevieve, so I'll kick that over to you. The question is, does the health insurance industry utilize underwriting, and are they being monitored and audited for the premium rates?
Wow, that is a question. So we do not manage, that's a great question. We do not manage the policy portion of it. We work with the Office of Insurance Commissioner to, they really go through the plans and certify plans on our end, and then we offer them on our marketplace. So this question would be more along the lines of appropriate for the Office of Insurance Commissioner. So unfortunately, I can't answer that just because um, we offer the plans and they really manage the marketplace and oversee that.
Thank you. Have another question for you, Genevieve.
Yeah.
From your vantage point, what coverage trends are you seeing right now among workers and families in Washington, particularly those experiencing job changes or gaps in employer-sponsored coverage?
Yeah, that is a great question. So now, particularly for middle and higher incomes, we are seeing that premiums are jumping up. So before, subsidies, particularly federal subsidies, were available to those at the 400% federal poverty level, which I think probably doesn't mean a lot to folks besides me, but they were just a lot more generous. Understanding that folks in the middle and middle high may still need some help with their premiums to make health insurance affordable. And so we are seeing for those middle to high incomes that their premiums have jumped. So those folks are looking for options that make a sense for them in terms of maybe higher deductible plans that cover less. So they're taking on a little bit more risk, is what we're seeing. This year, we did something that's called premium alignment. So we, really compared. Before we were kind of sticking people or recommending silver plans. This year, for the first time, we were recommending kind of gold plans for people because they offered greater coverage at a lower cost, and we were able, depending on folks' income, able to draw down some more federal subsidies for folks. So we're really, trying to see how the market is shifting, trying to recommend plans as the market is shifting that do make sense for folks that allow us to, utilize some more of the savings and allow people to still get the coverage that they need. But we have seen for those middle to high income folks that their incomes or their premiums have jumped more than they have in the past. Yeah.
Thank you.
Yeah.
Jane Hogland with Health Benefits Washington, moving over to you. Many employers are feeling pressure from rising healthcare costs. What trends are you seeing in employer-sponsored plans, and how are businesses adjusting their benefit strategies in response?
Well, uh, this year was extremely challenging for all of our employers. 96% of Snohomish County businesses have less than 50 people, and 90% have less than 20 employees. So we're talking about a very small business having to absorb it, tremendous cost increases. For the most part, the premiums all went up about $100 per person, ranging from 20 to, I had a group hit 40%. Um, Speaking to the underwriting, generally the underwriting is for an ERISA plan, not an ACA plan. Like a ERISA plan would be a level or a self-funded plan where they actually rate the group based on who is in the group. And that's where the underwriting comes in. Most insurance is based on the business that you're in, your NAICS code, the age of the group. So they take the total age of the group of participants and average that to get your rate. And gender does play some distinction in there, especially for some carriers. And your zip code is your service area, just like with the county picking out which area they're in. Um, so rates are getting extremely high. We're finding a lot more groups of one, which is an employer-owned W-2 employee of a company that collects Social Security and Medicare on their check, is eligible for a benefit of a employer health care plan. And then that way the employer is able to use these costs to reduce their tax liability. That's the biggest reason most of the employers go into this market, so that they're able to save those dollars. Using a cafeteria Section 125 plan will reduce your out-of-pocket costs for both the employer and the employee for their 941 taxes on the FICA and Medicare, and for the employee also on the federal withholding. That reduces that weekly or monthly deposit that you're making to the government. And it also shows that the employee's taxable income at the end of the year is reduced. Therefore, they pay less taxes at the end of the year as well. A lot of our employers are choosing higher deductibles. And if they're able to choose multiple plans, the carriers allow that your base plan, the lowest cost plan, is the base plan that the employer contribution is tied to. So if the employer is contributing anywhere from 50 to 100%, that the difference is paid by the employee, and then the employees would buy up if they pick an alternative plan with a lower deductible. That's a nice way to give people options, but keeping the employer's costs down. Another way that I've seen employers adjust is to increase the cost share of the employee. Like I said, currently they're able to charge between 50 and 100%, depending, or 0 to 50% to the employee for coverage. And some employers do include coverage for their dependents, but it's not required by most carriers. So you're able to provide coverage for your employee either with or without assistance, and then they would pay for their dependents. There are so many things going on in the industry right now. This cost of healthcare is the second biggest concern. The Association of Washington Business Executive Survey came out yesterday, and it is the second most concerning item for employers after taxes. So it's a big deal. And we like to work with our employers at least a couple months ahead of time to make sure that they have time to look at all their different options, decide what's going to work best for them and their employees, and then be able to pick a plan that they'll be confident of for the rest of the year. And unless you're on a trust plan, you would be able to change carriers mid-year if you needed to, if it didn't work out. But most people, if you put that time and effort into it up front, then you're not going to have to be changing anything up mid-year, which is always disturbing for the employees.
Right. Thank you, Jane. Saray, from a pooled member-owned perspective, how are small and mid-sized employers navigating affordability challenges while still offering competitive benefits?
Yeah, I mean everything Jane just said, right? Our employers, we serve about 1,300 employers in the state of Washington, which is about 30,000 people. And healthcare costs, there's not a silver bullet. I mean, they are going up year after year, and we're not seeing trends go down, right? We look at national, just as Jane was talking about. And Washington is even more expensive, right? We are an expensive place to live. We're also an expensive place for healthcare, because it kind of goes hand in hand. So how are they navigating it? I think they're they're not, or they're doing their best, right? They're all kind of sludging through this together. And I think, as we continue talking through the panel, some ideas of, how folks can start to control those costs a little bit. But one of the things we've seen a lot is really education more of their employees, right? Prescription drugs are a really high cost driver. My general rule is if you saw a commercial during the Super Bowl, ask for something that is a generic version of that or a biosimilar, right? We all, see all the commercials and know how expensive it is, right? Those are costs that employers are eating, right, in premium increases. Education around that. Education about where to get care, right? It's hard to get care. I think the recent study by 2030, there won't be enough primary care physicians in the state of Washington to serve us, right? So a lot of folks are going to urgent care and the emergency room for things like an ear infection or a sinus infection. So we've really tried to equip our members with education abilities, right? Easy toolkits to forward on about where to get care and how to get care at the lowest cost, right? Can you start virtually? Is there a platform that you're really, feeling well served, which we have, I'll talk about in a little bit, incorporated into our strategy for cost reduction. But health insurance is really hard. I talk to employers every day, and the theme is very common. It's like I pay so much for healthcare, and then my employees have to keep paying to use it, right? It's a very common frustration. And I think, part of navigating this in the next couple years is one, acknowledging that we're frustrated, and then trying to start looking at things differently, doing some education and those sorts of things, in addition to kind of plan design that Jane was talking about.
Thank you. Kind of digging into this a little deeper, we had a question in the chat from Robin. What hurdles are you feeling healthcare providers are experiencing, and are premium costs affecting this? Robin says she's curious if you're hearing anything from a benefits angle.
Yeah, I would say, so many things. One, there's a lot of billing things that healthcare providers have to do, and healthcare providers are also employers, right? There's a lot of the stuff they have to do for their employees as well. Adding that additional layer of, pre-authorizations and such, we're starting to see more, especially in physical therapy, which don't get me started on that. But that really drives more administrative cost and more costs in premiums long term. Another thing that I'm seeing is just less time with providers, right? There's more pressure to go, go, go. And, aside from, costs, for me, I have two young kids, and that's frustrating when it's like the amoxicillin still isn't called in. Like I'm needing to chase that down, right? And so it just makes healthcare harder for the employees. Meanwhile, we have providers doing their absolute best, doing the thing that they want to do to take care of Washingtonians and patients. There are a lot of pressures for additional billing, which means going faster, multiple appointments and less time.
Thank you. Jane, going back to you, how are healthcare benefits influencing recruitment and retention decisions right now, especially in a tight labor market?
I think that employer benefits are the number one thing that employers are looking at to retain their employees. I have several groups that have told me this year that if they didn't have the package that they did, they would have lost employees. So that is very key. I've taken on 5 new groups just since the beginning of the year that needed to have health care so they could get these employees. So therefore they began the search. And candidates are looking before they even take an appointment for an interview. It is really key factor in healthcare. I was looking at some stats this morning, and the numbers for cancer, musculoskeletal conditions, and heart disease over the last 3 years have increased exponentially and are driving the costs along with the cost of drugs. And if people are not getting educated and getting in and seeing a provider, they're not going to get taken care of, and all of these costs will explode. Because the sicker you are, the more it's going to cost to make you better. And if we can get you in right away so that everyone has a free preventative exam with their health insurance. Most insurance has a copay for a doctor's visit. And getting that small bit of education out there is really key to your employees, especially the younger ones whose parents may have been on some other kind of plan, that so they don't understand that they can go see that doctor when they need to instead of waiting until they have an emergency when it costs them way more than it needs to.
Mm-hmm.
The other thing is encouraging them to use walk-in clinics or urgent care facilities rather than going directly to a hospital where they're going to invite their deductible and out-of-pocket costs.
Thank you. Genevieve, how does the exchange support workers who move between jobs or experience changes in hours or income? And what should employers understand about these transitions?
Yeah, we work really hard to make sure that those folks are not falling through the cracks. We know that it can be overwhelming if you're separating from a job and you're losing, maybe your paycheck, but also your health insurance. And so we have, someone that's dedicated to supporting separating workers through what are called rapid response events through workforces around the state. And so, definitely there are resources out there for you, but also just keep in mind if you are separating from an employer or if you have separating employees, that they're, connect them to Washington Health Plan Finder, to Jane at Health Benefits Law, and make sure that they understand their options, understand that they're likely eligible for a special enrollment period to get covered outside of open enrollment. And then if they are, losing their income, they probably are eligible for quite a bit of savings as well on the marketplace. Maybe even free health insurance, through Apple Health. And then if they do, get this another amazing job afterwards, they'll just want to make sure that their application is updated so that they're no longer receiving, those savings that they are eligible for. But as Jane was saying, be informed, know your options. A lot of people just, sign up for Cobra. And while Cobra, is an option, it can be a very costly option. And so making sure that you are informed and know your different options that, provide you kind of that safety net and coverage while you need it until you find that next amazing job. So be sure to tell workers that are separating if that's happening to you. Connect with Jane and explore all those options.
Great, thank you.
Mhm.
Saray, what role can alternative benefit models or collaboration play in helping employers manage long-term costs while maintaining workforce stability?
Yeah, I love this question. So we have three core values. One of them is to be an employer resource, right? Help people navigate all of healthcare things. Second is for employers to get more and employees to get more for their benefits. And the third is for healthcare to be efficient and effective. That third one is like so hard. And this last year, we launched a new program that we include with our products. So we have Kaiser and Primera, both underwriting and ACA plans, and it is so cool. It's called Nice Healthcare. I will drop something in the chat, and I encourage folks to check it out. So the model here with Nice Healthcare is it starts virtual, right? I was talking about virtual care. First of all, clinicians get 30 minutes each to talk with you, right? So you can actually get those questions answered, actually get that prescription sent in. They cover about 70% of all of the medications that all of our population takes in full. And every time somebody uses Nice Healthcare, there's no out-of-pocket cost. They do labs, they can do x-rays, and they can even help with some common things that are usually not virtual care, like ear infections, because we've developed something that we call a care kit. So we give all of the employees who have coverage with us, and our average employer is like about 12 employees. We have lots of small ones and we have some big ones. But in this care kit, there's a digital otoscope. So that tool can take high quality photos of ear, nose, and throat. And just last week, my nephew had a double ear infection, and he was able to get treated virtually because they could see that eardrum, be able to clinically diagnose that, right? And then send that prescription into a local pharmacy. It is not how healthcare works. It blows my mind still. And they are just doing things differently. And I think that is one of the keys for employers to start thinking about, right? There have been very few options that are really different or actually different in the marketplace, and this is one of them. So I really encourage folks to at least to take a look at it. I love talking about nice healthcare. I will, restrain myself a bit, but it's really cool. And it allows employers to maybe start thinking about higher deductible plans because it gives all of that everyday care, right? That, both preventive and that cold or flu, mental health, physical therapy is virtual without a copay, without a deductible, even on an HSA eligible plan. So it really is insurance or healthcare done differently. And it's really cool. And it makes people go, how can this be? Because we're so used to it being hard. So I think that's one of the examples of how if we start looking elsewhere and start thinking about things, that can start drive down not only the employee's cost and encourage them to use it, but also employer costs long term, because that is a virtual visit is far less expensive than an emergency room to look in that ear for my nephew. So
Thank you. And a reminder to everyone who RSVP'd for today's Zoom that we will send out a post-event email with the resources like Nice Care that are being shared here today. So, Saray, this one's also for you. Looking ahead, what should employers be planning for now in terms of healthcare benefits over the next few years? We saw from Genevieve that there's some changes coming at the federal level. So.
yeah, I think people should be planning for it's not going to get cheaper, right? And so being proactive is really important. I mentioned, there's probably a couple things I would say tangibly for employers to start doing even now. First of all is identifying some resources to educate their folks, right? We talked about, various virtual care pieces, how to get care, where to get care, about preventive care, value-based care. The Washington Health Alliance is a great resource. They, can tell you where to get the most affordable and highest quality knee replacement or, those sorts of things. So it helps kind of cost across the board. So kind of that education piece is key. Second is what I call benchmarking your benefits. I really believe that the market and employers are served better with choice. And as Jane was talking about, this year was hard for employers. There was a lot going on. Brokers had a lot going on with all of their clients. And now is a great time. We partner with basically every broker and we can do the heavy lifting. Like, do you think I got the best plan for the best price, right? That serves my employees best. Um, there's no Google for that. And we want to help equip people to at least have that information. And, I'm an employer as well. And, for me, being able to be like, okay, it was really expensive, but this is the best for my employees. Or, oh my gosh, I didn't. And then you have a different conversation to have, right? As a business, with your broker, all of those things, because changes are very disruptive as well. But I really encourage folks to benchmark their benefits, particularly this time of year, and just kind of help equip yourself with that. And I think the last piece is to just continue to be vigilant, right? To look at the policies that are happening, make sure that you're kind of up to speed. And while I don't see healthcare costs going down anytime soon, I don't think that's a thing. But it is important that legislators hear the hard from employers, right? There's a lot of other things going on in the legislature and such that also impacts costs, right? And so employers being able to say, like, I'm already shouldering a lot, right? I can't do anything more. I'm doing my best here and it's hard, I think is also key, not just for healthcare, but also to tell the story of employers in Washington that they try and take care of their employees, right? And healthcare is one of the ways they do that.
Thank you. We had a question come in the chat and a comment that the education piece is key. So are there any concerted efforts to improve health literacy that you're aware of? This person is referring specifically to the K through 12, but do you know of any programs? Or I know a lot of you do outreach, so.
Yeah, I'm not aware of any sort of specific things. I will. There was another comment in the chat about early learning and developmental milestones. Partnering with organizations, as Marcy put in the chat, are they do a lot of education, right? As well as helping parents or caregivers with kiddos in the Birth to Three program. We have used the Birth to Three program when my kids were that age, and it's a huge resource for parents. And on the employer side, that's kind of what we're trying to do is help employers educate their employees, which is a hard topic, right? To talk to your employees about health, health issues is a fine line to walk. But I don't know, Genevieve or Jane, if you're aware of any kind of K through 12 type efforts.
Not necessarily K through 12, but we do partner with hundreds of community-based organizations that provide, presentations and outreach to the communities that they serve. So there is quite a bit of education going out there, understanding that health insurance literacy is not easy, but wanting to make sure that folks know that there are resources there to help you understand and guide you through the process. Jane, sorry if I stepped
Oh,
in.
no, not at all. There isn't very much formal resource, and although we do refer them to the state webpage to find some things. What we do with our clients is that we have an open phone policy, open email policy. If they have an issue, if they're not getting care, if they're concerned about their bill not coming in correctly, they call us and we help them understand what's going on. We'll call the carrier, work with them to come to a resolution regarding the situation. And it's all, you can only do so much education during a 15-minute open enrollment, but having them have the availability to call and ask questions. And the people on the health plan finder are really wonderful when you do have a question and you need to call and find out something. If you're working with an individual policy with us, I'm calling BHT or other carriers to find out, what they're going to do to help with this thing. But right now, it's more of a one-on-one personal thing, and doing something more broad range would be really helpful to everyone so that they can understand the whole system instead of just getting frustrated by it.
Thank you, Jane. This one's also for you, Jane. Could you tell us one or two practical steps employers can take now to strengthen their healthcare benefits and how they are explained to employees in a way that supports recruitment and retention?
The most important thing is for you to know what all your options are and to talk to some key employees in your business, not just the high level. Make sure you're getting to the ground roots because they're the ones that are going to be using their benefits, and find out, what's working for them, what's not working for them, so that you have a good feel for what's going to work for your entire group all at once. And then we do find that peppering in some voluntary benefits that people can take with them when they leave gives them a happy feeling, even though they have to pay a little bit more for their regular healthcare premium. The nice health benefit is a wonderful one. A lot of the other carriers are coming up with some virtual options for both medical and PT. So there are options out there, but until you take a broad look at all the different plans and what's available to you and have decided what are the key factors that are going to work best for your business, you won't be able to make a good decision. So information, 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 and ask, ask, ask.
Thank you. Genevieve, moving back over to you. What resources or information should employers and workers be paying closer attention to as healthcare policy and affordability continue to evolve?
Yeah, that's another great question. So, that as I mentioned before, the health insurance or the health benefit exchange doesn't regulate the marketplace, right? So I think, as I think Saray was saying, just making sure the legislature knows what your priorities as a business owner are, just making sure that they understand how important it is to offer your employees health insurance options. And then just making sure you do, like Jane was just mentioning, check out those options. Not all health insurance options are created the same. So if it does feel too good to be true, if you Google something and it seems like it's too good to be true, chances are it is, right?
Except nice healthcare.
Just making sure, not all plans are protected by the Affordable Care Act. So we hear stories of folks that, enroll in something online and they go to see the doctor, or heavens forbid, they come down, with something, an illness that, is quite expensive to treat. And then they say, oh my gosh, well, this isn't covered by my plan. I went directly to a carrier, not necessarily on the marketplace. And just not all health insurance plans are created the same. So please be educated on your options and the protections that are available to you, and make sure that those plans do protect you in a way that you need. Connect with a broker. There are people that know this industry in and out, and they are great resources out there that can help you like 95% of the time free of charge. If they do charge a fee, they need to disclose that up front. Most of our brokers don't. They just provide their services free of charge. So there's help out there. Connect with it. They are waiting there to help you.
Thank you. And also to you, Genevieve, how can employers and workforce partners better understand and utilize the exchange as part of the overall health care support system for workers?
Yeah, so we do have a small business outreach coordinator that can connect you to a broker. And we did recently, get a small business special enrollment period approved. And so small business owners under 50 have a special enrollment period available to them. It's a one-time special enrollment period. So for you and your employees, you can, if you qualify as a small business owner and connect with our small business outreach coordinator, enroll outside of open enrollment. We understand that as small business owners, the seasonality of your business may not always align with open enrollment, or when you hire folks, it may not always align. So we can get you, the opportunity to enroll outside of open enrollment if you are a small business owner and have employees that are not currently covered, or you do just want to be able to help them out. We know that you want to do right by your employees, and we want to support you in that.
That's fantastic. Thank you.
Mm-hmm.
Jane, how can employers more effectively communicate healthcare benefits and coverage options to employees so they feel informed and confident using their plans?
Many of the carriers have come up with digital training options where they send to the employers monthly so that they can share those in their company emails or in flyers with their payroll checks. Little reminders about what they can do to take care of their health. Employees that enroll on the apps for each of the carriers will have all of their health information right there on their phone or on their computer where they can access it, check out what doctors are available, can search for the cost of the health treatment. Many of the carriers have portals within their portal so that you can search to find what is the best medication that's on your formulary so that you're able to get that covered. What doctors are the best for this type of surgery? Which surgical center is covered at a lower cost than some of the other ones? And all of these things are available within both the portal and on the app. So encouraging your employees to actually take a few minutes to enroll in that and then look and see what's available is really important. I do want to encourage everyone to always look at your explanation of benefits before you make any payments besides a copay, so that you're making sure that you're paying what you're supposed to per the insurance company and not what the doctor's office is telling you, because sometimes that information hasn't been processed properly yet. And if there's a discrepancy, ask someone about it. Many carriers send a lot of marketing materials to the employees and the carrier or the employers. People throw it away. But encouraging them to take a moment to just glance through it and find out if there's something new that they didn't know about. It's just super important that people understand that they have a stop loss on commercial plans. Their max out of pocket prevents any cost beyond that amount through the end of the year. So if they had a major medical expense come up, they could be capped and not have any other expenses until the end of the next year, because that expense has been capped for the year. It's really important to understand that. And these are just things that we try and do whenever we're working with the employees, and I'm sure you guys do as well. It's just so important that they know they can ask if they don't know or if they forget. They just have to have that door open and that hand open to them.
Thank you, Jane. We had another question come in the chat from Gerald. Gerald says the federal administration is encouraging association plans. Are there any emerging in Washington, and will the health plan finder assist?
I can take that one because we are an association plan.
Mhm.
So yes, the Trump administration in the first term very much promoted association health plans and made it easier in other states to do them. We've been around for 30 years. So Washington is actually one of the healthiest association marketplace. There's a lot of association plans, and association plans are geared for employers. So in terms of the Washington Health Exchange, that's more of the individual market. I encourage folks to, when you're talking with your broker, to say, "Hey, I want to include this as an option," right? Again, back to the options, right? It's maybe a different plan design, maybe a different cost structure, or underwriting guidelines, those sorts of things. And it's really making sure you have different types of plans that you're looking at, not just a number of plans, right? You could look at a plan between Regents and Primera that are both the exact same underwriting, methodology, and which is great. And you should add in something else that's underwritten differently, like an association plan. I will say for small employers, association plans are a great spot because you usually get more with it. Like for our employers, they get our team, right? We can help partner with Jane and go out and help educate her clients and partner with them and the care kits. And, we also include Archbright, which is an HR resource, right? So at least taking a look at that is something. But when I was speaking earlier about like staying up on, what's going on from the policy perspective, this is a great example, right? It's something being talked about and making sure that you're aware of it and then kind of including that going forward.
Thank
And
you.
I don't want to undermine Surrey, but they're not currently offered on Washington Health Plan Finder just because they're
Yeah,
not
exactly.
covered by the Affordable Care Act and don't necessarily cover the essential health benefit, the same thing, the consumer protections. But yeah, definitely worth considering all your options.
Yes. Yeah, they're not on Washington Health Plan Finder. Maybe I said that incorrectly. They're not. Yeah.
Right.
Thank you. And Saray, this one is for you as well. What examples have you seen of employers or organizations successfully collaborating, either regionally or across sectors, to improve healthcare affordability and workforce outcomes?
Yeah, I think one example is BHT, right? We work with a number of partners across the state, including Economic Alliance Snohomish County, so that their members can get access to this. We like to partner with all to expand access as much as possible. Through that partnership too, we also, try and find opportunities to, educate employers, even on topics that aren't health benefits, like in the state of Washington, if you have more than 5 employees, you will need to have a 401k plan in 2027, right? That's something folks don't know. So bringing opportunities to give feedback on policies or education, ask questions, partner on things that are, other things touching employers, we try and do. And we do that largely in collaboration with our chamber and association partners across the state. Ultimately, BHT, we are member governed. So folks that have health insurance with us are the ones making those decisions. And, that in and of itself is a collaboration. And making sure that we're just looking to partner with anyone that we can to really move things forward.
Thank you. And that concludes our Q&A portion. Thank you again to our panelists for sharing your time, expertise, and perspectives. And thank you to everyone who joined us this morning. Today's conversation reinforces what we continue to hear from employers across Snohomish County. Healthcare coverage is not just a benefits issue, it's a workforce issue. Rising costs, access challenges, and uncertainty affect recruitment and retention decisions, employee well-being, and long-term business planning. We appreciate our panelists for helping unpack these realities from both the employer-sponsored and public marketplace perspectives, and for highlighting where better communication, coordination, and collaboration can make a real difference for workers and businesses alike. This discussion builds in part on feedback we gathered directly from employers through EASC's ongoing healthcare survey, which we will share with you in the post-event email. And it will help inform our ongoing work as we continue to convene partners, elevate these employer voices, and advocate for solutions that strengthen our regional economy. Before we wrap up, here's a quick look ahead of some events coming up for EASC. Our next coffee chats will be a 2026 legislative wrap-up. We are now over halfway through this short session, so we'll be highlighting some key outcomes and regional implications, where we'll review highlights from the 2026 Washington State Legislative Session and talk with state legislators about what it means for our region. I'm also excited to share that the Business Builder Expo is back this year. We hope you can join us on March 31st at the Linwood Event Center for this one-day event that will bring together expert panels, hands-on workshops, and robust resource fair, and lender matchmaking, everything entrepreneurs need to start, scale, and grow their businesses. So if you are a sole proprietor, an entrepreneur, or someone just interested in starting a business, we hope to see you there. And to register for these events or learn more about EASC and our work, please visit economicalliancesc.org. You can scan the QR code on your screen and it will take you there. And thanks so much for being here with us this morning. We'll now go to gallery view so we can see all your smiling faces. And if you have a coffee, please raise it. And cheers to partnerships and community spirit that keeps Snohomish County safe, healthy, and thriving.